I will give you some of the core 5 gaps in cancer control, not just in cancer care. There's number 1 is in screening, right? Nigeria today, we don't have a national cancer screening. So what that translates is that people only have access to screening sporadically. Number 2 is we don't even have cancer guidelines. Today, most of the guidelines we are all using are guidelines from the American Cancer Society, from the NCCN, that's National Cancer Comprehensive Network. None of these guidelines were actually, developed with our own patients, with our own people. Access to radiotherapy is another major, huge gap. Because most of the cancer we see in Nigeria and in many parts of Africa today actually come up at very late stage. And as I mentioned in my first gap, early detection can only happen through screening. The number 4, also very important, is actually affordability. Treating cancer is so expensive all over the world. There is no place you go that cancer is cheap. The 5th gap that needs to be closed is that of the gap of research. As we talk today, many of the cancer drugs that are used in Nigeria and in many parts of Africa are not field tested with Africans or field tested with Nigerians. To check evidence, to check if this medicine works for these people or not. I mentioned the first gap that needs to be closed is the gap of access to cancer screening. The simple way to close it is for the federal government, the state government, to have cancer control plans and have cancer screening programs. Cancer screening programs will help to ensure that people who are eligible for screening get screened. And as I mentioned, having guidelines. Number 3 is that we need access to treatment. Cancer treatment should be decentralized. People should not be traveling kilometers before they are able to have access to cancer treatment. And how are we going to do this? State government should invest in cancer. Cancer should not be left to federal government alone. Really, commendation to the federal government that had made strides in 2020, budgeted about 729 million naira to support indigent cancer patients who are battling with breast cancer, prostate cancer, and cervical cancer. It's called the Cancer Health Fund. Then the other way we should also close this gap is, as I mentioned, access to treatment, like access to prevention, which has to do with human papillomavirus vaccine. So we as a country need to sort of get closer to our people and passionately care for our people.